So now we're going to talk about draping the ALI UPS. And as you can see, there's a specialized drape that's customized for this particular product that actually allows for easy draping of the instrument without compromising the sterile operative field. And so here I'm going to go ahead and open the packaging. And you're going to find that when you open it, and first of all, you don't want to open this up prematurely, because you want to make sure that you have access to these clips that are here. And one of the things that I like to do is actually note where the cutout is on the top of the ALI UPS, where this clip is going to fit into. Often what I do is I just have a habit of, once I have the foot pedal, is just orienting this in a way that allows me to see it very easily, and then I lock it in place. And as you can see, I'm going to bring this in. There's an opening here at the top of the drape, and I'm going to just place that over the top here, and you're going to see that clip in. And you're going to hear it clip into place, right? When you hear that click, you know you're knowing the right location. Then you're going to grab these tabs right here that you see in my hands, and you're just going to pull that downward. And as you pull that downward, you're going to see how very quickly it allows you to drape the instrument. And then you can just adjust this. And then the next thing that's important to do is make note of the drawings on the side here. What you're going to notice is there are drawings that indicate whether or not you're going to be using this particular adapter for the Advincula Arch or the RUMI system. You know, in other words, you want to make sure that this is lined up to accommodate the particular handle for the uterine manipulator that you're using. And as I said before, one of the things that you're going to want to do is, as you get ready to go ahead and put the rest of your drapes on and get the patient set up and the operative field all prepared, you can certainly just pull this out of the way to keep it from obstructing any kind of view or access to the patient until you're ready for it. So as you can see here, I've actually taken the liberty of grabbing one of the drapes with the adapter on it off of the ALI UPS. And this way I can actually go into a little bit more detail about how this integrates with the Cooper surgical uterine manipulation systems that exist out there. So I'm going to start first with the Advincula Arch. And you can see the handle that's here, and it's actually attached to a RUMI tip as well as a coefficient colpotomizer system. And as I stated before, it's really important to pay attention when you have this attached to the ALI UPS to look at this drawing that's on the side. So if, for example, I'm going to use this particular handle, the Advincula Arch, what I'm going to do is rotate this so that this handle is oriented in the way that it would work in the patient, right? So I'm going to step on the pedal and I'm going to turn it this way, because that's how I'm going to mount this handle onto this adapter. And one of the things that you'll notice is that these adapters fit particular grooves within the handles. So in this case, if I'm going to utilize this adapter in this orientation, you can actually feel this thing sit in place when you slide this handle in there, and you're able to lock it like that, right? That's what you want to do. So I'm going to go ahead and take this off of here and show you what that looks like when we mount it on here. You're going to feel it. Now this is technically going to be in a patient, right? So I'm going to go ahead and show you what this would mock up. But let's say this is positioned this way in the patient. You're actually going to feel this thing. There's a groove that you're going to feel this thing sit in, right, as you mount this. And when that sits in the appropriate location, you'll know, because there's a feel to it. And then you're going to be able to lock it into place then like that, right? If you don't have it in the proper location, let's say we have it this way, and you try to close it, it's not going to clamp down. So again, you want to make sure, first of all, it's oriented in the proper location. You're going to feel that thing sit correctly in the appropriate groove, and then you're going to be able to lock it, okay? And then once it's in place, then you can go ahead and manipulate it. Now, one thing that I want to point out to you, and I'm going to move these other manipulators out of the way, is that when you do make your subtle adjustments, you want to actually do two hands. You want to be able to hold, and I tend to hold both the handle of the uterine manipulator as well as partly the clamp here, because it gives me better control. But I also take my other hand and I use this to adjust what I call the gooseneck component of the ALI UPS. And that allows me to get greater flexibility and range of motion, which I get a lot easier than just doing it with one hand. So as you can see here, I got one hand securely in the manipulator, but I can also adjust. And again, my foot is on the pedal so that it allows me to create the different angles that I need. And then once I have an angle that I want, I'm going to hold it, let go of the foot pedal, and it's going to lock it in place, right? And of course, to remove it, very simple. You're going to pop the clamp, and the device comes out. So whether you're using this particular handle, the Advincula Arch with a coefficient colpotomizer system, or even if you're going to be performing, for example, a procedure where you need to do sacrocolpopexy and you have a tip adapted for that attached to the handle, same concept in terms of how you place that onto the device. Again, you're going to feel for that groove right there, and once it's in place, you can lock down the clamp, and again, you can make your adjustments, right? And then when you want to remove it, you just pop the clamp off the top, and then this comes right out, okay? Now, I'm going to show you then how you can integrate the RUMI handle, right? So as I said before, I'm going to show you up close here. You zoom in on this adapter, notice that now I've changed the orientation and the drawing is representing the RUMI handle. So if you can see that, that's going to impact how this is oriented with the patient. So I'm going to go ahead and turn this, and you can see now, by doing so, I'm going to adjust the handle so that it's facing in this orientation. And this is where you want to be if you're going to use a RUMI handle, right? So I'm going to show you up close here how that works. And again, it doesn't matter whether the tubing is in the channels, the tubing channels, or not. I'm just going to move it out of the way just for the sake of demonstration here. But similar to the Advincula Arch, the handle, there is a place that this will specifically line up. And you can see here, as I lay this in here, there's going to be, you can almost feel like it's going to catch. And then you're going to be able to lock this down, right? So you can hear it clip down, and you know it's locked into place on this handle, right? Again, it has to be oriented in the right location, otherwise you're not going to be able to mount this. So I'm going to go ahead and let's mock this up here. Let's say that we're got this in the patient, and I'm going to make my subtle adjustments. It's going to sit in there. You can see that it fits in a distinct groove. I'm going to pull the clamp down, and you can hear it clip into place, and now it's secure. And then again, I typically will kind of hold both at the same time, and it just allows me to have a greater sense of control over how I want to position this when it's in the patient. And of course, you get some greater degrees of freedom of movement because here you can articulate and you can antiflex and retroflex at the same time. So you can really increase the amount of manipulation that you're going to get with this particular device. And again, once you find the proper location, you come off the foot pedal and you can let go, and it's very sturdy. It's going to hold into place, and it's going to help you delineate your anatomy or the location of the vagina based on how you position the LI UPS. And as I said before, very easy to remove. You're going to pop the clamp. This thing releases. You can move this out of the way and then do what you need to do to deflate the balloon and then withdraw your uterine manipulation system. So very easy to use. The nice thing about this device is it's very easy to set up. The draping has been significantly simplified. It is extremely sturdy, and once you place it in the position that you want and you lock everything into place, it doesn't move. And I think that's extremely important when you're doing a case where you want the uterus, for example, to be optimally positioned to, for example, perform a hysterectomy, or if you're doing a myomectomy, if you're suturing, you really don't want that target organ moving. And so by having something that fixes that into place, it's a tremendous asset, but also the ability to utilize the different uterine manipulators with this product. And again, the nice thing is economy of scale here because it's only one drape, one adapter that, based on the way you configure it, will allow you to use one or the other uterine manipulator.